who might vote against the bill. They are, of course, the critical votes as he tries to get to 60. House Majority Whip Elijah Cummings now joins us live from Capitol Hill. Congressman, thanks so much for being with us. Let's talk about the differences between the House and the Senate version. As you see the Senate bill, as Harry Reid has crafted it, they are very excited, of course, about their compromises. Went public with their bill last night. How different is it, as far as you're concerned, from what you want to see pass the House?
First of all, let me let you know that Jim Clyburn is our whip, and I'm excited that he is. But let me just go on to say that, Andrea, I am glad.
Congressman.
That's okay. I am glad to see the Senate bill go as far as it has gone so far. And now we've got to get it on the floor. Is it everything that I like? No, I like the House bill a lot better. But I do believe that we can see our road clear to get to where we want to go. Of course, right now we've got to get it on the floor, that Senate bill on the floor, to begin the debate process. And I'm urging every senator that I know, including the Republicans, to remember that the American people wanted health care reform during the election time, and now the least thing that we can do is let this bill get to the floor so that we can move forward.
Now, Jesse Jackson, the Reverend Jesse Jackson, has slammed one of your colleagues, Congressman Arthur Davis, in South Carolina, for voting against the health bill. And he said at a congressional reception last night that we even have blacks voting against the health care bill. You can't vote against health care and call yourself a black man. Is that the right kind of rhetoric to be using against people who voted against it? Is this some sort of litmus test?
I would not say that, but I will say this, that health care is very, very important, Andrea. There are literally people dying in our districts all over this country. Every 12 minutes, we've got somebody dying because they don't have health care, and there are a lot of other people who are suffering. People watching us right now. They don't know how they're going to get well. And so I just think that we have to deal with this urgently. And I know that the Senate, again, is talking about filibustering and all this kind of thing. What I say is get the bill on the floor, do your amendments, whatever they may be, and let's have an up or down vote. They pushed hard, our Republican friends pushed hard to have Republican votes when they were trying to have Republican judges a few years ago appointed. We say that this is a more important issue because it goes to the very health of our people and addressing things like pre-existing conditions and making sure that more people become insured.
Now, what about some of the other issues like abortion, like immigration? When the Senate grapples with this same issue that the House grappled with on abortion, what do you want to see the Senate do? Are you hoping that they don't go for the restrictions that were in the House bill?
Yeah, I do. I must say that. I think that the Hyde Amendment is sufficient enough. I think that, I think we're there in the House bill. And I have a firm belief that both sides will come together in conference and resolve that matter. And I'm hoping that they will be satisfied that the bill has the kind of restrictions that are appropriate and consistent with the Hyde Amendment. As to the immigration issue, I think that we'll be able to resolve that too. The key is we've got to keep our eye on the prize. That is the big picture, Andrea. Keep in mind that folks have been trying to revise health care in this country for over 60 years, and we are now on the 1 yard line. And all we've got to do is go across. We cannot fumble this ball. And what I'm saying to our senators, some of our senators who have high, very high uninsured rates in their states, at least let this thing get debated. Now, if they want to stay here over the weekend and through Thanksgiving, Senator Reid and others have made it clear that that's what they'll do, but they will stay. But if they want to fight against their very constituents who need this health care and need it badly, you got to wonder about that.
As a matter of fact, Senator Harry Reid, the majority leader, has just told reporters on the Senate side that they will have the first test vote on whether to permit debate to proceed, at least on the Senate side, on Saturday. So he's going to have votes over the weekend. As we know, there were charges from the Democrats that the Republicans in the Senate were going to slow walk this and demand votes on at every step of the way to even try to get it to the floor. They're trying to get to the floor by Monday.
Andre, I think if the Republicans try to do that, that would be a major issue. They've got to let this thing move forward. I'm glad to hear what you just said, if I understand it correctly. But we've got to move this bill and have an up and down vote. And so that Americans can get well, so that Americans can prevent some of the diseases that they're now suffering from. To me, I've told people that this is out of all my years in being in public office, over 20-some years, this is the most important issue that I will face because it is a life and death issue.
Thank you very much. Congressman Elijah Cummings is passionate on this issue, and we appreciate it.
And happy holiday to you.
It's great to talk to you. Thanks.
Already.
Thanks to you. The same to you. And the first Capitol Hill hearing on the